Today we're at One and Truly Dental in Glen Cove, New York, in this beautiful spa-like setting. It is the home of Dr. Gupta. Welcome to the show. How are you?
I'm very well, thank you.
From the moment I crossed the threshold, I just felt like I was transported somewhere different. What is your philosophy in dentistry?
Yes, so as a person, I'm a yoga instructor, I'm a Reiki healer. So my practice philosophy is a mix of three aspects: conservative approach, minimally invasive dentistry, and use of a lot of technology. So that goes along with our trademark mantra, less dentistry is best dentistry, because I believe that the nature is the best engineer, and we try our best to preserve and maintain what nature has given us. And we go to great lengths to avoid very invasive or aggressive dental treatments. So I've curated a lot of technology over the years, and I've taken a lot of CE courses to learn a lot of minimally invasive techniques. So whenever we have to treat, we use like less aggressive and minimally invasive treatments.
Dr. Gupta, you mentioned biomimetic. Is that how you say the word?
Yes.
Okay, what is that? What is biomimetic?
Yeah, so before I talk about biomimetic dentistry, let me talk about the problems and challenges that I face and a lot of dentists faced with the traditional dentistry.
Okay.
So what happens is you get a filling, and over time you get decay underneath it, or the filling pulls away, causing the bacteria to get into the filling and making decay underneath the tooth, causing discomfort and pain, and making you need a root canal, or the tooth fractures, or then we have to do a crown, for which we have to take away a lot of tooth structure, which weakens the tooth structure. So biomimetic dentistry is a complete paradigm shift in that way, the way we look at dentistry in a new way. So with biomimetic dentistry, we strive to preserve as much tooth structure, conserve as much tooth structure, and remove only the diseased part of the tooth.
Okay.
And we also follow a set of evidence-based guidelines and protocols to create restorations that are bonded to the tooth very strongly, to have very good bond strength. So when a restoration is created that way, there is a lesser chance that it'll get bacteria underneath it or it'll get decay underneath it. So that way, we minimize the need for root canals, minimize the need for aggressive dental treatment, crown, or redoing the treatment. I have seen in my personal experience that when I use my biomimetic techniques, patients have lesser sensitivity, lesser discomfort. We have minimized the need for root canals a lot in this practice using
Which is amazing,
Yes.
because root canals, it's very painful, you know? So it's kind of reminds me of when somebody fixes up an old house and they restore the woodwork, the beautiful woodwork, instead of just like carving out too much,
Yes.
right? So you can
Yes.
restore the beauty of a tooth now.
Yes.
I totally understand that by just that simple analogy. So what you're doing is you're taking what you can save and then you're reconstructing it.
Yes.
Okay.
Yes.
Very, very wonderful. Now you have an expensive piece of equipment. I'll just say, I don't like the word expensive, but let me just say that it's state-of-the-art equipment, and you're one of the very, very few that have it. And so many people fly from out of state actually to come to your practice.
Yes.
What does that magic tool do? Is that the thing that helps put fiber on your teeth?
No.
Okay.
So that is our machine. It's called Photona Lightwalker. It's a combination of two lasers. So one is erbium yak and neodymium yak.
Okay.
And with that laser, we use it to disinfect teeth. We use it to do a lot of other treatments, like we use the laser snoring treatment. We use a laser lip plumping treatment, which is a lip enhancement treatment without the use of Botox and fillers. We also use a smooth lace treatment, which is like a non-invasive facelift, non-surgical facelift. It's a facial rejuvenation. We use it for gum treatment. We use it for like a wide range of dental treatments. I'm actually using it to do root canals, and I've seen great healing with root canals when I use that laser. You know, a lot of times when we drink water, we feel cold because, like, you know, we get sensitivity around the gum lines. And then, you know, you have to go get either like filling done there. But with this laser, we shine the laser on the tooth for like 1 minute and the sensitivity is gone right away.
Okay. So therefore, if somebody does need a root canal, you can also help them. So if you can preserve the tooth, you will. If not, you could do this minimally invasive root canal, less pain for them and quicker healing.
Yes, and one of the most amazing use of this technology is something called photobiomodulation.
Okay.
Photobiomodulation is like, you know, when we shine the laser on the tissues, it creates some cellular changes that accelerate healing in the tissue. For example, when we're doing the extraction, particularly third molar extraction or any other surgery, when we shine laser on that after the extraction, the healing is accelerated. You have less pain, you have less swelling, so that way you're taking less painkillers when you do it this way. And also, photobiomodulation, when we have cold sores, when we have ulcers, when children have ulcers, they can't eat. Like my son particularly,
yes,
canker sores.
Too much.
Yes, my son had ulcers, and I used this laser, and he wasn't able to eat for 2 days, and he was able to eat right away after the dental treatment with the laser.
As a child, I suffered from that as well, and I used to have to take these like little tablets. They were like malt flavored. I haven't thought about that in years, but the doctor said I was a worrier. Like I worried too much, which can cause you to have canker sores in your mouth.
Right, and it can be very painful for particularly children, you know. And with this treatment, like, you know, it's just 1 minute treatment, no pain, no downtime, and, you know, it's great healing.
That's wonderful. I do feel relaxed here. Do most of your patients, like your new patients, walk in and are they like in awe of the space that you've provided for them to help them heal, like even mentally, I guess?
That is true. So as you come in, you will see, like, you know, the diffuser with the essential oils are going on. There's light music going on. And I think I have a very calming personality. And along with everything that's here with the ambience, I think patients really feel like, you know, it's a stress-free, anxiety-free environment.
When you first come in, like, is there like a free consultation? Like, how do you walk someone through the steps? Because a lot of times people are so, I guess they're still afraid of a dentist. I'm trying to like shine a light on you, so I say there's nothing to fear. Dr. Gupta has you, right?
Yes. So when people call me for consultation for biomimetic treatments, the consultations are free because I want to first see whether I can help them. You know, because what happens with biomimetic dentistry, you know, a lot of times the teeth that are deemed unrestorable or they were considered that extraction is the only treatment. With biomimetic dentistry, we can actually still restore them, build them back up. So I want to first evaluate the patient. That consultation is free.
Okay.
And then once we can help them, we go through the financial.
Wonderful. Yeah. That's so important, I think, because I think there are so many people that want to do something, but they are afraid. The other thing that I love is you had mentioned that facelift type of situation, which you do, I believe, is it from the inside out? It's like you treat the inside?
Yes. So it is only inside the mouth.
Okay.
Actually, we do nothing on the outside. So when laser energy interacts with the tissues inside the cheeks, it stimulates the tissues of your body to produce more collagen and remodel the collagen. So that way you get, you know, those jowls, you can treat those, and you get a very nice facelift without anybody knowing that you did anything.
Lovely.
It's great for wrinkles, and sagging skin.
And backstage, we were also talking about these lines, like as we age, you know, the tissue just kind of like sometimes falls a little bit. Yes. So this kind of plumps it back up. Yes. And lips. Yes. I love the lips. I saw pictures of lips that you've done. So it looks like Botox, but it's not.
It's not.
Okay.
So basically, you know, a lot of times when people have done Botox, you can look at them and you can tell.
And they look like this.
Yes. Yes. So with these treatments, because it's your own body healing it, it's your own body producing more collagen. It's basically, that's why we call these treatment facial rejuvenation. Because we are bringing the tissues back 10 years because it's your own body. It does require a number of sittings. So for example, the changes are so subtle. Mm-hmm. You know, you come every 3 weeks for at least 3 treatments, and that's when, you know, you get the result. But it's really a non-invasive and, you know, holistic type of treatment.
Now, I know that you grew up in India. You have a lot of education. I asked you what your favorite toy was as a child, and you said to me, you're like, all I did was study, because that was the culture growing up, right? Yes. You're the daughter of educators. Education is very important to you. You're constantly learning. Is that why you implemented like the latest technology? You had mentioned to me that technology is so important to you. Do you love just studying up on that and then bringing it into your practice?
I think that's also a quest for excellence. Okay. You know, how can I help my patient? How can I get this thing perfect? The perfectionist in me, and also my inclination towards natural healing methods. So I am a Reiki master, I am a yoga instructor. So all that kind of like comes very naturally to me.
Lovely. Congratulations to you on this beautiful place and all of your patients. You know, I'm very happy for you. And as I said to you, I've been doing my television show now for 17 years. And I said, just like you work with your patients and they're safe in your hands, I hope that you felt safe in my hands, because I really wanted to celebrate you and showcase all the great work you're doing. So you, so well deserved. Every accolade you have is so well deserved, Dr. Gupta.
Thank you so much.
Happy
Thank
journeys
you.
to you in your practice.
Thank you so much.
I hope you enjoyed this visit. I know sometimes dentistry can be super like scary or whatever, but please go to her website, learn more about her practice, and anywhere in the country, feel free. She has patients from all over the world, actually. Thanks for watching.